apex of heart. This would sit just like this on your chest. Left axis deviation, just like that. That's how your heart sits. Okay? So we're going to go inside. So we know right here that is my inferior vena cava. We're going to start at that inferior vena cava, because the other one over there, I'll show you, I mean a superior vena cava. I'll show you the inferior on that one after. So I coming up this way, meeting it under here, would most likely be the inferior vena cava. So it would all collect into this region here. So it comes into my, I'm coming into my right atria. So we're going to open up that atria and open up the whole right side of the heart. And this is what we want to do. Just like that. We've opened it all up. If we really get posterior on it, which we have to, then you're going to see, again, the fossa ovalis. So now I'm between the two atria. That's the wall between the two atria, right here, where my fingers are touching. So that'd be the left, this is the right, okay? And then just below it, if we get in here deep enough, is the sinus. This is where all the venous of the heart drains back from the heart. All right, because the arteries are going to leave through the aorta. So we know we're in the right, so I make this nice and big. I know I'm in my right atria. Well, here's my valve right here. So right here, I'm lifting up on the tricuspid valve. Okay, there's a piece of it here, a piece of it here, and another piece over here. So 1, 2, 3. Three cusp, tricuspid. Here's your chorda tendineae, my papillary muscle. Come down in here, and these ridges, these are the trabecular carnae. All right, and the ridges are there for a reason, to make turbulence and make it fire better. You know what this thing is? It's not on the board. You're not held responsible for it. See that coming on? That's a nerve coming on. That's the moderator band. And what it does, it comes off the bundle of his and brings impulses to the outside of this wall to control it. That's why it's there. Okay, so now we've entered this. So we've entered through the tricuspid and we've gotten into it. Now we want to leave. So we're going to follow up this way and we're going to go where? We're going to keep going around and around and around until I finally get to my pulmonary artery. And the way I'm going to leave right here is through my pulmonary valve. And there's your valve. And I'm going to get to the pulmonary trunk, and then eventually I go into one of the arteries right there or here. Okay? So I'm heading to the lung. Now I want to come back to the heart. So I'm going to come back. Which way? Unbelievable, that squirmy thing. We're going to come back through one of the veins here, pulmonary vein, and I'm going to go into my left atria, correct? So there's your left atria. Everybody see that? So here's my left atria. So we roll the left atria open. And see, this is what I mean by pectinate. See this shape of this versus myocardium. See that to this? Big difference. Okay? So we're going to enter down into our left ventricle through the mitral valve, which is the wall, the door between these two chambers. And again, the same thing. There's the valve, chorda tendineae, papillary muscle, trabecular carnae. Those don't change names. Same name in both chambers. Then I'm going to leave the same way. I'm going to leave up through this way, and there's my valve. So there's my aortic valve, and now I'm in the aorta, and I can go out through the brachiocephalic or through the aortic arch and where I'm going to go. The coronary artery is right here. That's the first branch leaving through. It's a hole right in the aorta. See it? See that right there? That hole? Mm-hmm. That's a coronary artery right there. See that hole I'm sticking the probe in? See the hole I'm sticking the probe in?